All the delegates are requested to keep their mobiles on the silent mode. Kindly be seated. Thank you. Welcome to all the dignitaries on the dais. Good morning to all the dignitaries, guests, teachers, colleagues, and all the delegates present. A very warm welcome to the International Conference on Current and Future Perspectives of Pharmaceuticals in Healthcare, organized by School of Pharmaceutical Education and Research, Jamia Hamdard, and Delhi Pharmaceutical Sciences and Research University, sponsored by AML Pharmaceuticals. Let us start our day with the blessings of Almighty. I request Mr. Khurshid Ahmed Sheikh, PhD scholar from Jamia Hamdard, to recite few verses from the Holy Quran, followed by its translation.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. أيحسب الإنسان أن يترك سدى ألم يكن نطفة من مني يمنى ثم كان علقة فخلق فسوى فجعل منه الزوجين الذكر والأنثى أليس ذلك بقادر على أن يحيي الموتى صدق الله العظيم. Does man think that he will be left neglected? Was he not a nutfa, mixed semen poured forth? Then he became an alaqah, a clot. Then he shaped and fashioned him in due proportion and made him in two sexes, male and female. Is he not able to give life to the dead? Thanks.
Now I request all the dignitaries for the lamp lighting ceremony. The dignitaries on the dais, please be.
Equality and liberty. As rightly said by Rabindranath Tagore, where the mind is led forward by thee into ever-widening thought and action, into that heaven of freedom, my Father, let my country awake. celebrations of the day, I would now request Professor R.K. Khar sir, Professor Sharia to
Dr. Rajiv Singh Raghuvanshi, Drug Controller General of India. We welcome you, sir. A big round of applause, everyone. Our guest of honor, Professor Afrozul Haq, Vice Chancellor, HA University, Imphal. We welcome you, sir. A big round of applause, everyone. Everyone, please keep applauding. Professor R.K. Suri, Pro Vice Chancellor, Delhi Skills and Entrepreneurship University, New Delhi. We welcome you, sir. Professor P.K. Sahu, sir, Director, DIPSAR and Dean and Research Innovations, DIPSARU, New Delhi. We welcome you, sir. Next, we have Professor R.K. Khar, sir. He's the Director of B.S. Anangpuri Educational Institutes, Faridabad, former Dean and Head of Jamia Hamdard as well. We welcome you, sir. Without taking much time, I would like to call upon Professor Roop Krishan Khar, who is a renowned academician and a research scientist. He is also the director of a leading pharmaceutical company, Unicure India Limited, and executive director of a consultancy company, Formulators Concept Limited.
Delegates and friends. Well, it's my pleasant duty to welcome all the guests who have come here to attend this conference today and set the ball rolling for the day deliberations. Right at the outset, the chief guest of today's function, none other than Dr. Rajiv Singh Raghuvanshi. Sir, your august presence here today is a great source of inspiration to all of us, and especially the younger generation. If you look at his career, how he has grown, you should always take inspiration from Rajiv and where he is working and how he is working. I would like to say that, sir, you are an excellent example of private-public partnership in human resources of high net worth individuals. It's an excellent example because he has been in the industry for a long time, and now he is occupying one of the most important and a prestigious position in Government of India. Sir, we are very, very pleased to have you here today, sir. Thank you very much. Well, the chief patron of this function, of this conference, is Dr. M. Afshar Alam, who, due to some reasons, has not been able to come over to this place, some important urgent meetings. Well, I would certainly like to put on records the thanks and welcome in absentia for our dynamic Vice Chancellor of Jamia Hamdard. Well, I think that Jamia Hamdard would be the youngest private university with the quality assurance attributes of highest order. And it also represents, and I think, a 50-year-old pharmacy school, which is one of the topmost institutions at present, and it has gained the position of NIRF #1 for last 3 consecutive years. And they are all collaborating with this institution. I welcome in absentia Dr. Afshar Alam as well, who could not attend this conference due to some or the other reason. Well, since he is connected to the online mode, he would be listening to us, and he will be giving his blessings and greetings to all of us on this great, lovely occasion. Then we have Honorable Guest of Honor, Dr. Professor Afrozul Haq, Founder Vice Chancellor of HA University in Pal, which is a central university. Sir, you also founded the School of Interdisciplinary Sciences at Jamia Hamdard not much long ago, when we worked together across the road, pharmaceutical sciences and interdisciplinary sciences. which became a very, very important nucleus for high-end research, nano delivery systems and everything. We have all very good laboratories of global standards in that building where interdisciplinary sciences was located. Sir, very much, we are very, very pleased to have you here, and we welcome your honorable presence on this august occasion, sir. Well, another young gentleman here, guest of honor of today's function, Dr. Rehan Khan Suri, who is Pro Vice Chancellor of Delhi Skills and Entrepreneurship University, Government of NCT, Delhi. Sir, we feel privileged and honored to have you today here and offer you a very, very warm welcome from our heart. And I know that you have grown into an eminent educational administrator and an academician over the years. I remember having spent with you very good time at Jamia Hamdard. There was always a spark in you. There was always an enthusiasm in you. And you always loved to excel. And we know you laid a very, very good foundation for placement services in our university, Jamia Hamdard, to which I belong to proudly. Sir, you should be an inspiration to all the young people staying here, what to do, and how to excel in life. Well, you are also associated with a very, very innovative type of a concept, the skill university. And I think you can inspire the students to acquire their life skills, which is very, very important. You can have a knowledge body, but unless and until you have your life skills, you integrate your knowledge body with life skills, you will not be a successful person. That is what I think Rehan Khan will tell you and inspire you in his lecture or in his address later after this time. Then we also have another guest of honor which has not been able to come here, Dr. Avadesh Kumar. I hope he is online there. He is a Pro Vice Chancellor at Galgotia University, Greater Noida. Lately, you all know that many private universities are doing well. They are working hand in hand with government institutions, and I have seen in India that there are many good institutions which have come up, and Galgotia University is also emerging as one of the good private universities with good quality indicators, with good quality assurance attributes. Well, we also have, because you know that we are collaborating with two institutions, we have another representative of who represents Delhi Pharmaceutical Science and Research University, Dr. P.K. Sahu. He is the Dean of DIPSAR, which is the original institution which has been growing for last about 50 years now almost, and one of the another institutions in Delhi NCR with which we are collaborating. Thank you very much, sir, Dr. P.K. Sahu, for taking out this time today on a Saturday morning, a holiday, and you have spared your very nice and lovely time. Thank you very much. Off the dais, I am very, very thankful to all the eminent speakers who would be addressing this conference little later. I am also thankful to all the eminent guests and the faculty members of different institutions, student delegates, and all of you. Thank you very much. You have made it a lovely presence here, and it is your presence which matters a lot, and that makes a conference a success. Well, I would also like to congratulate PRS Educational Trust for having conceived this conference with a contemporary theme which is related to pharmaceuticals and healthcare. They are inseparable. You cannot separate the pharmaceuticals with the healthcare. Let us see how we perform during the day to know what all we have to listen from very, distinguished speakers. As you know that we told you that we are collaborating with two best institutions, the top institutions in Delhi NCR. One is Jamia Hamdard and other is Dipsaru, and certainly they are undisputed leaders and excellent institutions in the country by all different types of global standards and national standards. Adding to the grace and the value of this conference is the excellent ambience of this venue. It will create an excellent platform for the seminar, for brainstorming sessions, and for discussions through the day to make it very purposeful and outcome-centric. We have eminent faculty from industry, from academia, from abroad to address these delegates, and it depends on you only how you will be able to make use of these teaching and learning process, which is going to start after some time. I would not like to take much time because I know there are learned guests on the dais and there are many speakers off the dais. I would like to leave it here and wish you all the very, very best for the whole day, and take away, you are certainly going to have a good day. Jai Hind, God bless you. Thank you very much.
Thank you, sir, for such a warm welcome and bless this conference. Now I request Dr. Shweta Sharma, Member Trustee of PSR Educational Trust, a keen worker of the Trust and academician at Galgotias University, for a brief introduction about the PRS Educational Trust. Ma'am, please.
Thank you, Manvi.
Delegates, my seniors, my colleagues, and all the candidates present over here. On the behalf of PRS Educational Trust, a member of PRS Educational Trust, I am giving a brief about it. PRS Educational Trust was founded in 2016 by Shrimati Pramod Sharma, and it is a team of high-spirited, tireless, intellectual persons who are having a sole objective of providing value-based education in the reach of all. So it promotes and supports the healthcare segments and emerging professionals. We are providing career development opportunities, education and training, certification courses, knowledge sharing publications, networking, and other valuable resources. The Trust is an international membership organization of pharmaceutical professionals who are dedicated to advancing the profession and providing the highest level of support, knowledge, directions, and standard of the pharma healthcare community. So, our mission is we foster an entrepreneurial spirit that gives us freedom to challenge the conventional thinking and ways of working. We work with openness, integrity, and devotion to create an environment of trust, integration, innovation, and growth. Our vision is to emerge as a leader of global repute, dedicated to create an ecosystem of trust and dignity, integration and knowledge sharing, novelty and innovation, and growth and prosperity. Our pillars are International School of Applied Pharmaceutical Sciences, that is ICEPS, the Association of Young Pharma Professionals, International Journal of Pharmaceutical Professional Research, Pharma Olympiad, scientific writing services we are providing from our this trust, and under the PRS Educations we are providing paper publication services, patent processing.
first International School of Applied Pharmaceutical Sciences. So it was established in 2020, and we have started 7 industry-oriented unique courses, which are these: Drug Regulatory Affairs, Management of Drug Medical Store, which is solely for diploma students, Clinical Research, Quality Assurance, IPR, Pharmacovigilance, and Scientific Writing. Our association is the Association of Young Pharma Professionals. It is carrying out various collaborative professional activities, which include organizing training programs for pharma professionals from industry, academics, regulatory and practice, making representations to the authorities on matter of professional interest, and working towards constantly upgrading the standard of professional services offered by the pharmacist. You can visit us at www.aypponline.in. Next, we are also running our journal that is named as IJPPR, International Journal of Pharmaceutical Professionals Research. So, it is publishing research articles as well as review articles from various researchers among the country. Our journal publish information comprising the versatile directions of concept of skilled researchers continuously in present and future era. Next, Pharma Olympiad. As we have seen that various schools are conducting Olympiad exams for the students, so we have started this Pharma Olympiad only for the pharmacy candidates, research scholars, as well as pharmacy professionals. We have started in 2020, and we have conducted Pharma Olympiad first in June 2020 and next in September 2020. And our planning to conduct third Pharma Olympiad in the month of August of this year. Scientific writing services we are also providing under our trust. A professional and knowledgeable scientific writing services allow you to develop, plan, construct and deliver a research paper free of error and publish in peer-based scientific journals with a high impact. So we are assisting pharma candidates, research scholars to write their paper in a better manner so that it can be submitted to a peer-reviewed journal. Under PRS Educations, we are providing book publication services as well as patent proceedings. In this conference, our objective is to concentrate on recent advances and modern trends in pharmaceutical research, including NDDS, advancement in phytopharmaceuticals, and paradigm shift from therapeutics to biologicals. So goal of this conference is to create an interactive forum for renowned speakers and competent resource people to present insightful sessions and lecture on the current and potential directions of pharmaceutical research. Our major contributors are these. You can contact us at PRS Educational Trust, and mobile number as well as email ID is given over here. Thank you.
Thank you, ma'am, for acclimatizing us with the PRS Educational Trust. Moving on, I would like to introduce our first guest of honor, Professor Rehan Khan Suri, Pro Vice Chancellor, Delhi Skills and Entrepreneurship University, New Delhi. Professor Rehan has served as a professor at Jamia Millia Islamia Central University, New Delhi. He has 29 years of academic and industrial experience. He's an academician, researcher, trainer, career expert, and social engineer. We welcome you, sir.
Thank you so much. Bismillahirrahmanirrahim. Honorable Chief Guest, Dr. Rajiv Singh Raghuvanshi, Drug Controller General of India, my dear friend, mentor, Professor R.K. Khar, Professor Afrozul Haq Sahab, Dr. P.K. Sahu, Ruhe Rawa of this program, Dr. Shehryar, PRS Educational Trust officials, my colleagues, I can see many here, Zeenat, Javed Saab, Imran, many people are here, delegates, and the future of this country, scholars, students, participants. Very good morning to all of you. First of all, I thank Shahryar Saab for giving me this opportunity to just come back home in a conference organized by Jamia Hamdard and getting an opportunity to interact with my old colleagues and just sharing some views with the youth of the country and the students of this great university and other institutions. As I belong to Delhi Skill and Entrepreneurship University, I just would like to tell you what about, it's a new university, young university. It was established in 2020 during the COVID. Government of Delhi founded this university with the purpose to create a skilling ecosystem to prepare future workforce in the country. You might have heard Skill India Mission, Atmanirbhar Bharat. Our Honorable PM has given a call. Many initiatives are there already. But we have to understand that first. I'm not from the field of pharmacy. That's why I'll not talk on that. I'll just talk on that, what I belong to. Yesterday, incidentally, in our university invited a guest to interact with our students and faculty, Amy Migloi from Cadence. I don't know whether you have heard that company's name or not. They're into drug designing. And the topic was, how can we integrate drug designing with the technology, especially in terms of AI and ML. You might have heard this artificial intelligence and machine learning. What is the future? I was simply asking one question to Amy. I asked whether this technology will replace clinical trials or not. She said, this is challenging. My dear friends, you have to look at the future. It's not a matter of soft skills. It's not a matter of technology. It's not a matter of domain knowledge. Matter of vision, matter of goal. Why are you studying? What is the purpose of this study? Just for the sake of some crores of rupees of packages? Not exactly. If you just look at some history of some pharmaceutical companies, they have brought down the prices of very costly, very important, critical medicines. Are you really able to do that? Are you going to do that? Have you that vision? The country of 140 plus, the highest population of the world, what you are thinking for them? That is basically the real worry. India is leading the world. What would be your contribution to that? How will you make this nation a better place for the people? From all perspectives, we have led already. We have proved our mettle during the COVID. What would be your contribution when you will be there in the industry? I know you are studying in the topmost institution of the country. Jamia Hamdard is, yes, institution of the excellence. Dipsaru, my sister institution, I belong to the same ministry. Both are doing excel. We are getting the cream of the country as the students. We also expect the same. You please focus on that. You have to deal with interdisciplinary sciences. You have to learn, you have to understand, you have to collaborate, you have to look at the future. What would happen after 10 years, 12 years, 20 years, and many more like unprecedented situations like COVID. Be ready for that. You should learn how to present. You should learn how to address the unprecedented situations. You have to learn the pace. We have to focus on speed. We have to focus on scale. We belong to the country which has really the diversity, size, and different kind of challenges. Please set your goal, set your vision, get the purpose of your life, get the objectivity of your study, be prepared for the challenges when you will enter in the industry. And such kind of conferences like today's will definitely deliberate. It would be a great learning to all of you. It would be an exchange of knowledge, which is really helpful for setting your goal, for preparing for the future. Not only the domain knowledge, along with domain knowledge, you have to develop many things. Please understand the importance of the time. We have lot many distractions every day, every minute. Avoid those distractions. Learn how to collaborate, how to team up. How can we get the benefit of other strengths? Respect other strengths also. That would help you. And I congratulate PRS Education Trust, Jamia Hamdard, Dipsaru, and the organizers of this conference for organizing such a beautiful international conference. I'm using word beautiful because I'm finding many old friends here. And I wish the great deliberations throughout the day. Wish you all the very best. Thank you very much.
Thank you, sir, for your words of wisdom. Now I request Professor Afrozul Haq, sir, Vice Chancellor, HA University, Imphal. He is also our resource person for this conference. I request and invite you, sir, to please address the audience.
Thank you very much. Very good morning to all. Dignitaries on the dais, chief guest, my old colleagues from Jamia Hamdard. First of all, I would like to special thanks to Professor Shahriyar who gave me this opportunity. Many others, my friends and colleagues, Professor Javed, Professor Shaukat, Maulana Saab, आप भी को गया, and Professor Zeenat and Dr. Fazia. I'm really happy to see you all and all my students. Very good morning. First of all, I would like to say that this kind of gathering, meetings give us inspiration. Inspiration, once you are inspired, your neurons are activated. And once neurons activated, you will get much better understanding of any kind of topic or lectures discussed in the meeting. You feel euphoric, okay? So this is very important to have these kind of meetings and gatherings. I will start with Maulana Saab. This morning, the student who was describing the verses of the Holy Quran about the reproduction, the conceiving. As I have worked in this field for some time, it is really amazing what it was described in the Holy Quran 1400 years ago, how a baby conceived from the beginning till the end, it is beautiful. The big reproductive biologists, those who are working in human reproduction, they are amazed to see this scientific fact description in the Holy Quran. Now, let us come to my topic, my favorite topic, that is my research that I was involved for the last 20 years, is vitamin D. Now, I would like to pose a question whether vitamin D can be used as a drug, because it is a pharmaceutical gathering, is a meeting, so we should talk about something related to that. So, can vitamin D be used as a drug? So, my answer is yes. Since its beginning, or since its discovery in 1920, for many years, 50 years, it was known for its role in the bone formation, bone metabolism, and making bone strong. But interestingly, it has been studied and researched thoroughly for the last 30 years or 40 years that it is not limited to the bones or bone metabolism only. There are many applications of vitamin D, and the reason behind it is that when it was discovered, it was only known that its receptors are specific to 2-3 tissues or cells of the body, that is kidneys and prostate and maybe one more to the skin. But later on, now it is known that the receptors of vitamin D are present in almost all cells of the body and tissues. And that makes it important. And those cells have the enzymes which are used to metabolize the vitamin D into its active form. It is involved now, it is known very well that it is involved in cancers, in cardiovascular diseases, hypertension, diabetes, and neurological disorders, as well as in all bacterial and viral infections, in COVID-19. So, the people and the researchers are working continuously on vitamin D and to producing its analogs. So, the analogs, what they do, they can be used as drugs. Now you can see in the market, Sorvate, there is one ointment coming in the market and very successful. Another one is calcipotriol. These two drugs are used to treat skin allergies, skin pigmentation, and diseases like psoriasis successfully. So definitely vitamin D can be used as a drug. Now coming to the applications, the non-classical applications of vitamin D. Non-classical applications, classical is related to the bones. Non-classical, anything which is non-calcemic, non-skeletal is non-classical applications. So there is a molecule called LL37, which is a protein, and it is a very strong antibacterial protein. It resides in NK cells, B cells, epithelial cells, and gamma delta T cells. And when these cells are activated by the analogs of vitamin D, then this peptide is released in circulation, which is a very strong defense of any viral or bacterial infections in the body. And that's how it is working in COVID-19. Okay? So now, nevertheless, there is a need of long-term clinical trials to know more about the mechanisms of vitamin D and its analogs, how it is working, and their adverse effects, and to know its therapeutic potential. The details, you will know all about it in my talk, which will after this session. Thank you very much.
Thank you, sir, for enlightening the audience with your research work on an important constituent of the body, that is vitamin D. Moving ahead, I now request Professor Zeenat Iqbal to introduce the speaker of the day, our chief guest for the event, to all the delegates. She is the convener of this conference as well. Ma'am, please.
Thanks, Manvi. Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. Good morning, Suprabhat. We are delayed a bit, so I would be taking it in a little fast way. But the person who is to be introduced is a person who needs a lot of introduction, yet he is very well known. So everybody knows him, but yet everybody should know him. So with these words, a formal introduction to the chief guest of the day. No doubt, it is indeed a matter of utmost privilege, honor and pride to introduce to this august house our most revered chief guest of the occasion, the greatest of all time, GOAT pharmaceutical scientist and researcher who has earned for himself a place, a recognition of highest order. Armed with a doctorate degree from National Institute of Immunology, NII, New Delhi, a graduation and master's from IIT BHU, and adorned and decorated with the much sought after ISB Kellogg Global Management Program, he ushered into his corporate career by joining the renowned MNC Ranbaxy Laboratories Limited, wherein he tirelessly worked for a decade and little more than that, developing NDDS, generics, and branded products for various global markets. His next significant career move came with his joining another multinational company, Dr. Reddy's Laboratories, Hyderabad. His more than a decade of association was extremely rewarding, and he helped change the growth trajectory of the company and played a pivotal role in expansion of its product portfolios. His expertise in dosage form brought in laurels in form of 14 granted US patents and a whopping 250 published PCTs and Indian patents. Yet he remained an academician at heart. He remained associated with pedagogy at premier institutes like NIPER Hyderabad and IIT BHU. He has to his credit more than 25 publications and co-authorship of 6 chapters internationally recognized. He is continuously chased for his scientific presence at both national and international fora, wherein his innovation-oriented talks become food for thought for plethora of scientists in making. To recognize his scientific acumen, Dr. Reddy's Laboratory Limited conferred upon him with Dr. Reddy's Excellence Award, not once, but twice. A believer of power of leadership, mentoring and hand-holding in the most altruist manner, he groomed an entire generation of pharmaceutical leadership. His mentees proudly occupy the most meaningful positions across the pharma world. The next step in his career was driven by a strong feeling of giving back and making an impact onto the society, and that brought him to the corridors of the real change makers, that is the government itself. He was given yet another key position which befittingly leverages upon his enormous knowledge of medicine making. He occupied the office of Secretary cum Scientific Director of Indian Pharmacopoeia Commission on 16th February 2021 and brought forth a sea change in governance of safety and efficacy parameters for the drugs and dosage forms. The ambitious pharmacovigilance and material-vigilance program of India got new wind under its wings and reached its higher objectives under his very, very able guidance. And then came another great milestone when Dr. Rajiv Raghuvanshi Sahib was actually bestowed upon with the greatest of responsibility, wherein he has an avatar of actually becoming the custodian of the national health. True to the Urdu Ashar, this pharma superman is poised to scale newer heights and is continuing his professional journey tirelessly. The couplet goes as, जिस दिन से चला हूँ मेरी मंजिल पे नज़र है, जिस दिन से चला हूँ मेरी मंजिल पे नज़र है, आँखों ने कभी मील का पत्थर नहीं देखा। मुश्किलें ज़रूर हैं मगर ठहरा नहीं हूँ मैं, मुश्किलें ज़रूर हैं मगर ठहरा नहीं हूँ मैं, मंजिल से ज़रा कह दो अभी पहुँचा नहीं हूँ मैं. So this man is on a tireless journey. And on this note, let's embark upon this blessed morning, enriching and blissful journey with our esteemed guest. Please join in me with a very warm applause, welcoming to the dais the newly appointed Drugs Controller General of India, Ali Janab Dr. Rajiv Raghuvanshi Sahib, to deliver the much awaited Chief Guest address. Thank you, sir. Please.
So good morning, and thank you, Zenith, for that wonderful introduction. So, respected Professor Haq, Professor Khar, Professor Suri, Dr. Sahu, lots of known faces, and of course unknown faces. So it's a privilege to be here, and always love to be among students. That gives you a feeling of that you still have a lot more to do. And this visit was due because, on the lighter side, Hamdard is my in-laws' place, and last time when I was talking to Zinat, she was inviting me for a program, so unfortunately, that was the day when I joined as DCGI, so I couldn't make it. So it was due, and I had to come for this program. So thank you again. Makes me emotional also because it's not very long. Time flies. Not long before I was like one of you. And I mean, coming to Hamdard again, I used to wait for my, that time, fiancée, she was not my wife, in the corridors of Hamdard, the other side where Dr. Khan's lab was there. And we were scared of Dr. Khan. And we would actually hide behind pillars when Dr. Khan, somebody would say that Dr. Khan is coming, but never left the place because my would-be wife was in the lab and I couldn't dare to leave the place. So those were the memories of Hamdard. And of course, I also came after that when and these were all when I was doing my PhD at NII. And then, after starting my professional career, I visited multiple times because a lot of my friends were actually faculty in Hamdard. Some of them are still there. So always loved that campus. So for today, I'm not going to speak a lot of technical because you all have a lot of technical mentoring. But what I would like to do is, since this gathering is full of students, from my experience, my personal experience, I would touch upon some of the areas where I think the students who are preparing themselves to start their professional career need to focus. And these are some of the things which would always be there for anybody if they have to succeed. Be it, times will keep on changing, the subjects would keep on changing, technology would keep on changing. But there are some things which are there today, they were there in the past, and they will be there in the future, which is more to deal with your personality and what is actually required to be successful and successful in your career, and how do you define success? Because success is a very comparative term. So let me start with the corona. We just came out of corona. The world has changed completely. It's not the same world where we were living before corona. Couple of days back, WHO also declared that we are out of pandemic. A lot of difficult times for all of us. But Corona has actually given lots of learnings also. And a lot of validations, what we used to read in bestsellers, in terms of management, in terms of leadership, in terms of how to become successful. So Corona is one phase which we would never expect and we would never want to come again. But there are a lot of things which are out of our control. And what we can simply do is to prepare for anything like that. We can't stop all this. It's beyond our control. So the first and foremost thing which Corona did in this world to demonstrate the importance of leadership. It's the one example where a country like India demonstrated to the world that an able leadership can actually tackle the most difficult situations. And it's actually people who were involved in that, they know more than the normal public. It would have been difficult for us as a country to actually handle this phase with the efficiency which we could do. And the results are in front of us. That doesn't mean that we did everything right. We might have done something wrong also during that phase. Something would have been done maybe better. But in totality, if we see today, it is an example of exemplary leadership from the country's political leadership at the level of Prime Minister of India. Corona phase has demonstrated the importance of collaboration. This is the first time in the history of this country we would have seen a collaborative approach to tackle a difficult situation between government and industry, which was never thought of. Government was always thought to be a very defensive organization, not at all open. Industry would think that their policies are always anti-industry because they always want more than what they're getting. And there was always sort of tussle between these two organizations. When Corona came, I think that was a time when somehow, all of a sudden, without much, within days actually, the platforms were created for a very close collaboration between the government leadership, government's bureaucratic leadership, and the industry leadership. And on daily basis, daily morning, both parties used to talk on video conferencing. And to the micro level of what is the inventory in your company of this maybe paracetamol API or paracetamol tablets or antibiotics or whatever it is. So that was a demonstration of collaboration beyond thinking of any of us. And that happened immediately as a response to the need which actually came because of Corona. Another big thing which Corona taught us as a country, it actually gave us that strength and a shift in mindset which now tells us that we can do it. There are a lot of things. I mean, earlier people used to think that it's very difficult, we can't do this. No, it's not for me. Someone else will do it. But after Corona, this is one thing which all of us have learned, that if we want, we can do it. And which is a big shift which has happened in the mindset and thinking of people. And now that is continuing, and we can see, and people are demonstrating that that shift has actually become part of life, and people are much more ready to deal with these kind of difficult situations. Another very important and very interesting observation is, it has again proven that if you have to do something, you should have a passion in you. You can't simply do things because you are told to do it. Unless until you have personal interest, personal involvement, which translates to passion, very difficult to do things with your optimal capacity. Corona was one time when I have personally seen, when Corona started, I was on the other side of the table. During the second phase, during actually the peak of the second phase, I actually came to IPC as its director. And since then, last little more than 2 years, I have been observing the kind of passion industry and similar organizations have demonstrated to help and work to solve a problem. Recently, I think not even 1 month back, when there was little surge in, and people were saying that phase 4 is coming. So immediately, proactively, we had to actually start reviewing the situation. That where are we? If something happens, are we prepared to do or not? And a couple of times, for 2-3 days, we had to actually reassemble and reactivate that machinery which actually handled Corona during phase 2 and phase 3, of course phase 1. And I saw that passion in the eyes of industry representative. And the best part was, it was not the top leadership of industry, it was the middle leadership of industry. So it has actually translated down from top to every layer of the organization. People have realized their responsibility and proven and demonstrated that when it comes to humanity and helping your society and public and life, we actually raise to that occasion. And we do much more than what we ourselves can think that what is our potential. It has also demonstrated very strongly the power of technology. We could not have been successful if the support from technology was there during that Corona time. Whatever this whole country did for vaccinating its population, right from manufacturing, or rather right from development of vaccine to manufacturing, to supply, or rather to procurement, to supply to the last mile of this country. I'm sure you would have, everybody would have seen those videos where people are walking with boxes of vaccine on hills and snow-laden peaks to deliver vaccines. All this was not possible if there was no support of the technology and the way immediately the technology development happened to support the need at that point of time. Be it your, all these apps which controlled the vaccination process, the data which was being collected. Lots of policy decisions happened based on the data which was collected during that phase. So the importance of technology and the importance of data collection. And for you guys, you also have to think that when you use technology, try to collect as much data as possible, because at the end of the day, today, data is the king. At every level, if you see, there is on the global level, there is a fight for data. To try to develop that knack of looking at data, analyzing data, interpreting from there. And at government level, most of the decisions which we take is dependent on the data which we have. And in wherever I have seen, wherever there is lack of data, the policy itself becomes flawed. So for stronger and stronger policy making, the robust data system is required, and Corona has actually demonstrated that again. So in totality, it was a difficult phase, but it actually gave us lots of learning from the leadership point of view, and those things are applied at every unit of this the systems which we have, be it your family, I can start it from individual, at your individual level, at your family level, at your organizational level, at your country level, and in fact beyond your country level. So that was Corona. For students to become successful, there is no substitute of knowledge. One thing you have to keep in mind, whatever anybody can say, there is no substitute to knowledge. And knowledge doesn't mean the subject which you are studying, not pharmaceutics, not pharmacology. These are all subjects you have to study to get the degree. But knowledge is beyond that. And I have experienced myself. Have that habit of acquiring knowledge in any area, and it never goes waste. It's a matter of just time. Some of your knowledge helps you in short term, some of your knowledge helps you in mid term, and some of it helps in long term. So never lose an opportunity to gain knowledge in any field. I have seen, it was my hobby to do, since my student days. I love to do a lot of things which were out of our pharma course. And lots of things which I did at that point of time, they are actually helping me today. So knowledge has no substitute. Another thing is knowledge is one thing which comes free. In today's world of internet, it is almost everything is available at your fingertips. But one more important thing related to knowledge is that you should also share as much as possible. And that actually multiplies. And it's all my experience. You will gain respect in your community, in your society, if you share knowledge. There are a lot of things. When we were students, there were lots of them, including me, who used to think that if I don't tell anybody, then I have power. I know, only I know. And still, I'm sure those psychologies are there. But the day you open up, you will see that whatever you know, when you start sharing, you are completely different in your community. People start respecting you. People, they will approach you. When we joined Ranbaxy, there were few people who were known for approaching if you have any problem, any technical problem. Go to, if I can take name, Indu Bhushan. One person, anybody can go for anything, like encyclopedia. And like Indu Bhushan, there were many people in Ranbaxy. And that is why that place was so vibrant when it comes to the technical knowledge. Whatever we are today is because of that environment where we spent some time. So share knowledge. Another very important, which also was demonstrated very strongly during COVID, is your networking capability. You cannot live in this society as an individual. Though we are born, people say we are born alone, we die alone. But in between, we have to live in networks. We can't live alone. Because network is one framework which throughout your life will help you in any aspects. That depends on what kind of network you create. It is not those social networks which we are on Facebook and Twitter. These are only distractions for me. You should have actual networks on which you can bank upon when you are in difficult times. They are very, very good examples from nature, if you see. And that also, again, my own example. We were vacationing in Odisha somewhere, in on the beaches of Puri somewhere, right, in very remote Odisha. And what I saw, I mean, that belt, there were lots of pine plantation beside the sea, which was a new theory about, I think, 15, 20 years ago, that became part of social forestry. And government actually does lots of pine plantation at the sea beaches. And so I used to think that why only one plantation? There must be something. So I actually asked one very local illiterate person there that why only pine trees are here. So I was told, sir, आपको नहीं पता है? नहीं, मुझे नहीं पता है. सर, ये इसके जो needles होते हैं ना, जो leaves होती हैं, वो ऐसे needle होते हैं, बहुत पतले पतले needles होते हैं उसके. So when they fall, they make mat kind of a mesh on the floor, over the sand. If you try to pick, you will see the whole like a mat you will pull out, because needle fall in different directions and they actually naturally get weaved in one another and create a carpet. And that carpet helps to actually stop the sand particles from flowing out and expanding that desert in the fertile area. So that's an example how this networking helps in actually protecting a fertile land from becoming infertile because lots of areas we have actually lost because of this flow of sand around the sea and ocean. Another very good example from again nature is, if you see on the western coast of US, especially in California jungles, it's full of redwood trees, very old redwood trees. And these are maybe some more than 100 years, 500-year-old trees. Very strong, very big. It goes to a long height. But the best part is, their roots are very, very small. They are few meters. Normally we say कि जितना बड़ा ऊपर जाता है पेड़ उतना ही जड़ उसके नीचे जाता है, otherwise उखड़ जाएगा वो. And western coast is also known for all these storms and tornadoes, and lots of them they come. Even then, these trees do not fall. And there, it is a researched fact. It happens because the whole jungle, their roots are actually, they are intertwined with each other. So below the soil, maybe below just 1 meter or 2 meters, you will see all the roots of the whole jungle are actually somehow intertwined. And that network actually stops them from falling and taking care of during. So just to prove a point here that networking is actually important. And you guys will experience when you grow. We have experienced it ourselves. But the most important thing there is, you have to choose who is going to be part of your network. And that is the most important thing at this age particularly. You choose your own network as per your liking and where you want to move. One of the speakers before me also was talking, I think Professor Suri was talking about the interdisciplinary education. If you see today, I mean, I don't hesitate in saying that for pharma education, if it has to be in isolation, we have lost the game. The fact is, the cheese has moved away from us because we did not take the corrective action at the right time. If you see industry, which is your biggest employer, today, some 15, 20 years ago, we never thought the product development would be done by chemical engineers. Product development will be done by a PhD in environmental sciences. So today, if you go to the top ranking university companies and industry in their R&D, you will see more non-pharma guys than pharma guys. And the reason is the science has become so interdisciplinary. The product which we now is coming out from these research institutes in the drug domain, they are all coming out through strong collaboration and at the interdisciplinary areas. So if we do not change now, whatever is left is also going to be lost. So please try to, again comes to the acquisition of knowledge. Please try to do as varied things as possible. Please try to be, if you have taken, completed bachelor's in pharma, you are open to choose, maybe change your field. Try to gain that knowledge at interdisciplinary areas. Today, if you see one example of product, I don't know how many of you would have taken note of it. There was one product which was approved in US, I think 4 or 5 years back. For a formulator like me, that was, when it was approved, I was probably the happiest person that this has now started. Because I used to think that someday we should do like this, and somebody did it. There was a product called Abilify. And that product, most unique thing in that, it was a very simple product, I think. 3D printing. So 3D printing was used as a technology to actually develop a tablet at commercial scale. In R&D, 3D printing is very easy. We can do a lot of things. But at scale, in medical field, they used 3D printing. But unfortunately, I don't see that extending further. There was another very beautiful example of blend of technology and pharma. I just forget the name of the product. But that tablet was actually compressed with a chip. So there was in every tablet there was a chip. And what was that chip doing? Chip was simply sending message to an app on your mobile that dosing has been done or not done. And it was for, I think, geriatric patients, I think schizophrenia, not schizophrenia, the forgetfulness, Alzheimer's, for patients of Alzheimer's. A lot of them actually forget to take their tablets. And it was only to basically give a signal that yes, the patient has taken the tablet. And just think that every tablet had a chip. But the best part was that now people can make tablets with a chip inside. And now the story becomes endless. You imagine anything which is happening in technology today can actually happen with tablets which you take. Formulators struggle most to improve the absorption of drugs and make the molecule cross the intestinal barrier. You won't be surprised one day that the molecules will start getting pushed because there is a chip in the tablets, and you can release waves which can actually push the molecules across the intestinal barrier. And it will be controlled from outside through your app. So this is the power of technology and the power of thinking, innovative thinking. One thing which I fail to, I don't know how many of you would have observed. In today's startup world, how many of them have actually come from pharma side? Very few. And people who have done innovation in pharma at the startup level, they are all non-pharma guys. Which proves that there is huge potential in pharma, but the people who are doing pharma are not capable of thinking innovative. You want somebody to come from outside and work in your domain to start a startup in your domain, which is pathetic for us. Just think over, right? And the opportunity is huge, but unfortunately, I don't know, maybe a problem with us as a system, infrastructure, the leadership, the educators, we are not able to create that atmosphere, that environment which is required for innovative thinking. Otherwise, everybody is almost same. Why does it happen only in the IT world? And why does IT people come in your domain and do innovation? You have to do it. So, this actually brings me to other point where you also have to take risk. If you are risk averse, you will never be able to achieve and actually move beyond average. And Vivekananda has actually very beautifully put it in a very simple term. Take risks. If you are successful, you will become leader. And if you fail, you will become guide. So it's actually win-win situation from both sides. Don't be afraid of taking risk. Unless until you take risk, you will never be able to achieve your potential. A lot of times we don't know our potential. So, lot more things. I don't know I have time or not. So, lot of things you don't plan in your life. If you ask me, 3 years ago, I never even dreamt of doing what I'm doing today. I was very happy in the leadership position in one of the best pharma companies in this country, and maybe one of the most progressive in the world also. Very big package, very happy life, good city to live, which my family still repents leaving Hyderabad and coming here. But what is important is, if you have to be successful in your life and actually use your real potential, you will have to come out of your own individual self. Everybody should have a purpose of your life which is bigger than you. Then only you will be able to work to your potential and you will be able to contribute to society. The day you leave your individuality and identify a purpose which is bigger than you, that's the day when you will see that magic and that potential in you which comes out. When I was 3-4 years ago, I was becoming impatient that life is becoming repetitive. Roz subah aao, project review karo, strategy banao, product push karo. Oh, it was becoming repetitive. And I was thinking that what to do, what next. So I had one very strong the inner voice within me that someday I have to give back to this society because I have got a lot of it from this society. And one of the bigger roadblocks in progression of your life is your comfort. Unless until we come out of our comfort zone, we cannot do anything. And very interesting, 2 examples, very short examples from nature. It is to do with, these are all connected. People say कि बहुत stress है industry में काम नहीं करना चाहिए आदमी. तो stress वो जो stress है वो हर जगह है. तो industry से ज़्यादा stress मेरे को आज की date में मिलता है जितना जो मैं आज कर रहा हूँ. So stress से तो we cannot actually move away. And there is a difference between stress and strain. Stress is good for your life. The moment stress becomes strain, then it is a problem. So you have to decide that to what point it has to stop. But you can't be in your comfort zone. You have to be out of it and take some stress. How many of you have actually reared butterflies in your life? So this is also a very bad situation. When we were kids, it was my hobby to go. Actually from class 2 I was in hostel, so we were in sort of jungle. Our school was there. So we used to enter in jungle and bring out those caterpillars. और वो जूते के डब्बे लेके उसमें ऊपर से छेद करके, and then we used to actually do that butterfly लाइफ साइकिल. ये कैटरपिलर छोड़ दिया, थोड़े मदार के पत्ते उसमें डाल दिए, 2-4 दिन बाद उसको देखा तो वहाँ प्यूपा बन गया, प्यूपा से फिर बटरफ्लाई बन गई, एंड बटरफ्लाई उड़ गई. So that was a hobby. A lot of us we used to do it. If you see that pupa, and if you observe, हम लोग रोज उसको डब्बे खोल के देखते थे कि कितना बड़ा है, कितना क्या हुआ. Someday you will find that one of these pupas has one butterfly actually coming out in front of your eyes. Wings, one wing comes out, and slowly the second comes out. If you try to help and open up the pupa yourself, the butterfly will die. It cannot fly. The reason is, it cannot fly because the moment you help the pupa open it, the butterfly actually doesn't do that flipping, and the strength in their wings do not come. So as a process, it has to make efforts to come out of pupa, and for coming out, it actually does that flipping, and in that, she gets the strength in the wings, and then it can fly. You just open it, it can never fly. वो मर जाएगी वहीं पे. पूरे wings बाहर भी होंगे लेकिन वो उड़ नहीं पाएगी. So that's a beautiful example of that slight stress which is required to be successful in your life. Another very good example. Most of you would have seen this bougainvillea flower, right? That very beautiful red, pink, white. And in summers, it actually flowers more, and you will see that whole, it's a creeper. So everything, the green leaves will not be there, only red flowers will be there. आप उसको रोज पानी दोगे ना, कभी भी नहीं, उसको खाली green रहेगा वो. There is an art that if you want that to flower into colored flowers, you have to stop watering it. उसको आप रोज पानी दोगे तो उसके सारे पत्ते हरे रहेंगे, उसमें फूल आएगा ही नहीं. And that is when you put little stress, when it has that stress of scarcity of water, that green leaves actually change to colored leaves, and that becomes your flower. So in life, you have to push yourself to a zone which is little stressful. But also, keep in mind, the morning of the day, if you don't feel like going to work, that means you are actually entering into a strange zone. Every morning you have to be happy and wanting to go to your work. That is the point where you have little stress. But जिस दिन आपका जाने का वापस मन नहीं करेगा, आपको समझ जाना चाहिए कि ये strain है ये, and you have to correct it. इतने प्रेशर के बाद भी, जितने आज की डेट में हम लोग के होता है पुल एंड पुश, every morning, I mean, previous night I sleep thinking कि जल्दी सुबह हो कि मैं जल्दी ऑफिस पहुंचूं. और ऐसा नहीं कि मतलब कि कोई बहुत बड़ा वो है, but it's only that passion to do something, to create that impact on society is actually driving person like me. मेरा कुछ नहीं है, जब मैं शिफ्ट किया तो I think now I get less than 10% of what I as a package, what I used to get in Reddy's. But मेरा drive क्या है आज की डेट में? I have a drive only that I have to do something. The money in the package is not my driver. That I have actually found a purpose which is much bigger than me as an individual. And that is driving me. And you guys also have to actually find that. Sometimes I feel that, am I late in realizing that? I don't know. इन चीज़ों कोई आंसर नहीं है. Every situation, you think that something could have been better. But I think we should get the best out of the position at which we are and make best use of what we can do. So, today if you see at the government level also, and at my personal level, at this position, I have that opportunity to create impact on society through service to patients. And if you have little spiritual bent of mind, I know most of people sitting here would have at some. So the highest order of service is service to patients, needy. And you guys are actually fortunate enough to get that opportunity to do something to help patients. And you have actually on your platter a situation where you have the opportunity to actually do the highest level of service. Nothing can be better than this. So don't let it go waste. Just reflect on the points which I raised today. These are, a lot of things actually have come from my own experience. When I look back and reflect, a lot of things today looks like everything was planned by somebody. The way things moved. We don't know our future, but one thing is very clear to me, that we might not know our future, but what is going to come in future is already planned. Looking at my past, I can believe this, that for everybody, everything is planned. We don't know, and that is why we have to use our best potential to actually do what we can do with our highest potential. Today, the campaign which we are running in this country, I want to spend a couple of minutes on the quality, pharmaceutical quality, because that is important. You guys are going to actually become part of that. You are already part of that, but you should realize that. So today, most of us, all of us would have seen a lot of press news and information about some product issues at the international level. So the point, they are bad. They should not happen. Nobody should die because of quality of the medicines. But the point is, why did that happen? And we did all that analysis, that why would have that happened. And then we are running a campaign in this country at the national level to do some risk-based inspections. We created a very beautiful framework where probably my past training and grooming has helped. And we identified some companies which need to be inspected before others. Because in risk-based inspections, you have to prioritize that which is most risky domain, you start with that and then you move down. And that framework is working so well that wherever we go, we find that company full of problems, right? And we are trying to correct that. But the point which I'm trying to make is, first of all, you have to be capable of taking those decisions that kind of intervention is required for a larger good of the society. Because there were people earlier also. There were inspections and audits happening since last maybe 1940 is the DNC Act. So 1940 के से ही inspections हो रहे होंगे, audits हो रहे होंगे. But today, if I go and enter a company, we still find companies where you cannot call it as a pharma company. You can't stand there. People are making tablets in one room, antibiotic, hormone, paracetamol, everything in one room. And this in spite of the regulation and audits happening almost every year because of one or the other reason. The things are happening on paper. And all of us are responsible for that. So when the real inspection started happening, people have started, and it was to come. I knew that it will come. The complaints to ministry, minister, PMO against me that he has come to stop and close down these companies. But good part is that the government is behind me and they also want that correction to happen. So nothing from that, no worry from that side. But the point is, when these complaints started coming, so government told me to talk to the industry people and just basically make them comfortable that we don't have any agenda. This is all happening because of the quality issues. We export more than 25 billion US dollars worth medicines from this country. So these are very small. If you see value or volume, they don't stand anywhere. These are all isolated incidences. But certainly they dent the brand of this company. We are pharmacy of the world, and we have reached to a position maybe at the top, but you also have to understand that reaching top is difficult, but more difficult is maintaining that position. For that, you have to slog more than the slogging you do to reach the top. So if we have to maintain that position of pharmacy of the world, we have to do lots of interventions to correct the issues which are happening. So one industry, I was having a meeting with industry association, and one person stood and said that, sir, till now we had facilitators, but since you have come, we see that regulator has come. So facilitator has become a regulator now. I said, very good, I accept. But let me also ask you a simple question, that your company is running for last 20-25 years. And for 25 years, if you had facilitators, and the state of matter is this, that I cannot go inside your company and stand there, then I would rather be a regulator, not a facilitator. Otherwise, we will keep on doing, and we will keep on getting these kind of news from Gambia and Uzbekistan and Marshall Island and whatnot. So sometimes you have to take these tough decisions for a bigger cause and bigger good. So I think I can keep on speaking for the whole day, but I'll stop here because there is a limitation of time. Thanks a lot again for giving me this opportunity, and all the best.
तो फिर मैं डाउनलोड कर देता हूँ।
नहीं, मैं यहाँ से पीपीटी भी कर दूँगी।
मैंने डाउनलोड में
ये भी ओपन मत तो पता चल गया।
आप इसे वो कर लेना।
Thank you, sir, for your words of wisdom and how we all should emerge as powerful, innovative, and knowledgeable in our field for a good quality of life. Now I request Dr. Fauzia Zakir for the conferment of Professor S.K. Memorial Best Researcher Award instituted by the PRS Educational Trust.
Thank you, Manvi. Good morning. PRS Educational Trust for the first time is conferring this award in the memory of late Professor S.K. Singh, who has been an exemplary academician and scientist. Please let me give a brief introduction of the awardee. The awardee has been bestowed with several honors for its outstanding teaching methodology and research outputs. He has been conferred with Career Award for Young Teachers by AICTE in 2003, APTI Young Pharmacy Teacher of the Year Award in 2004, Boycast Fellowship of Department of Science and Technology in 2005, American Association of Indian Pharmaceutical Scientists IPA Distinguished Educator and Researcher Award in 2007, Research Award by UGC in 2014, INSA Teachers Award in 2018, National Technical Teachers Award by AICTE in 2022. He has guided 87 theses of MPharm and 41 theses of PhD. He has an index of 77, more than 22,300 citations to his credit, featured as world top 2% scientist from India in an independent study conducted by Stanford University, USA. He is on the editorial board of many renowned journals, including Expert Opinion on Drug Delivery, Current Neuropharmacology, and Biomed International. He is actively engaged in committees of various central and state universities, Pharmacy Council of India, AICTE, National Testing Agency, National Board of Accreditation, National Assessment and Accreditation Council, and Union and State Public Service Commissions. For his dedicated, exemplary, and remarkable contributions towards the research in the field of pharmaceutical sciences, PRS Education Trust and the Association of Young Pharmaceutical Professionals bestows upon Professor Javed Ali, Head, Department of Pharmaceutics, School of Pharmaceutical Education and Research, Jamia Hamdard, the first late Professor S.K. Singh Memorial Best Researcher Award. The association also takes pride in admitting him the lifetime membership of the Association of Young Pharmaceutical Professionals. May I now request the chief guest and the dignitaries present on the dais to kindly confer this prestigious award to Professor Javed Ali.
I request everyone to give a big round of applause. Sir, would you like to say a few words?
A very warm good afternoon to all of you. Dignitaries on the dais, off the dais. I see many colleagues from Jamia Hamdard, Professor Shahryar, Professor Mumtaz, Professor Zimanat Iqbal, my friends, at Jamia Hamdard, fellow teachers, and I see many young minds over here. So I'm overwhelmed, right, getting this award, and though I speak a lot, but it is this moment is not giving me words to speak out. But at the outset, I would like to thank the visionary leader, Hakim Abdul Hamid Sahab, who took the idea of bringing up a pharmacy school in 1970s, which has completed almost 50 years. And the vision taken by him being taken by our legendary, Vice Chancellor, Professor Afshar Alam Sahab, right? And because of the free culture, freedom, we have done a lot. I think most of the teachers at School of Pharmaceutical Education and Research, Jamia Hamdards, are institutions in themselves, and which has, can be, seen by the NIRF ranking which started in 2016, and still every year we are getting the rank 1, being recognized at the, not only at the national level, but in the QS ranking and the world university ranking and so on. The recognition of this award is not only for me, but for a whole team of almost like 200 fellows over here, which includes my PG student who did their dissertation with me, my PhD scholars, my collaborators, and my fellow teachers as well. So thank you very much, right, for bestowing upon and the award to me, and particularly the PSR Educational Trust for recognizing it. Thank you all. Thank you very much.
Moving on, I would like to call upon Professor P.K. Sahu, who is currently serving as Director, DIPSAR and Dean and Research Innovation, DIPSARU. He is an expert member of various committees like AICTE Project Evaluation, BIRAC, NAC Committee, CSIR, National Testing Agency, GPAT exam. He is also the president of APTI Delhi. We welcome him for his presidential remarks.
Respected Dr. Rajiv S. Raghuvanshi, DCGI, the chief guest of today's function, Professor R.K. Khar, Professor Afroz Haq, Vice Chancellor, Imphal University, Professor R.K. Shuri, Pro Vice Chancellor, Skill University, Professor other dignitaries of the dais and known faces like Professor Javed Ali, Professor Jinnat, and faculty member from Hamdard, Professor Sariar, and Dr. Akil, the organizer of this event, and all the eminent speakers, all the participants and dear students. A very good morning to all of you. Actually, after listening to the speech of our Drugs Controller General of India, there is nothing to say anything about our profession and the different mantra he has given, that how stress is required so that you will bloom in your life. These are the things we have to remember. Even I keep a few of his lessons which I will practice in my life also. Here I can just emphasize a few of our strength of our pharmaceutical profession. This is such a profession that when I studied in 1980, there were only 27 pharmacy institutions all over India. But today, if you find, there are 4,500 pharmacy institutions, 7 NIPERs. There is a pharmacy, only one pharmacy university. 6 central universities are offering pharmacy courses. 487 pharmacy institutions in government, all government institutions all over India. And you will find all the private universities, they have a pharmacy department. And 50% of the engineering colleges, they have a pharmacy department. So the profession is growing, and we have 9 lakh pharmacies spread all over India. So this is our strength. You see, such a profession involving 15,000 industries. So these are the different strengths we have achieved over the years. 1980, when I started studying B.Pharm, that time I was thinking that, yes.
Yeah, just an announcement that we are honored to have His Excellency the Ambassador of Bosnia with us here. So please welcome.
Thank you. So this is our strength, that our profession involves so many professionals, and if you take all together, there will be 60 lakh people, they earn their livelihood out of this profession. The only, this is the strength, and the weakness I can say that our industry is not paying good salary to our professionals. It is only in higher positions, the way Dr. Raghuvanshi Saab told that only he is getting 10% of the salary what he was drawing in Reddy's, but that is in higher positions, but in lower positions the production manager, chemist and other things, they get very low salary. This is a weakness of our industry compared to engineering and IT industries. Otherwise, this profession involves so many people, and the profession got its recognition after this pandemic. That earlier people feel that pharmacy, it is a 10 by 10 room in a big hospital, and he will be simply honoring the prescription written by the physicians. But after COVID, लोगों का कान खड़ा हो गया कि ये फार्मा इंडस्ट्री क्या है, और ये वैक्सीन आ रहा है सेरम इंस्टीट्यूट से या भारत बायोलॉजिकल से वैक्सीन आ रहा है. India became the leader in manufacturing of vaccines all over the world, supplying to 144 countries. So this is the significance. Earlier we were insignificant in our profession, and this profession got its significance after the corona pandemic. It has been already cited by our chief guest during his speech. So corona became a, you can say that it opened so many doors for our profession to achieve newer heights. So with this, I thank the organizers to invite me to speak over here, and I wish all the participants and that there will be good deliberation in this conference throughout the day. I wish all of you all the best. Thank you.
We welcome His Excellency Ambassador of Bosnia. I request Professor Khar and Professor Afrozul Haq to felicitate the guest. A big round of applause, everyone. We welcome you, sir.
मुझे 1 मिनट का टाइम दीजिए प्लीज.
नहीं, आपने जो लिंक भेजा था ना उसी को कनेक्ट कर दिए.
सर वो तो लिंक
नहीं
आप स्टार्ट एन इंस्टेंट मीटिंग कर दो.
एक लिंक को दोबारा भेजना पड़ेगा आपको.
उसी को आप ऑन कर दीजिए ना. ये लिंक वेब व्हाट्सएप खुला है ना, इसको आप कनेक्ट करिए क्योंकि सर को भेजा हुआ है ना ऑलरेडी. आप
तो इसमें व्हाट्सएप कनेक्ट कर दो आप पहले ना. ये देखो व्हाट्सएप लिंक भेज दे. तो
कोई बात नहीं सर, 1 मिनट
ना, ये वाला नहीं.
आप दूसरा लिंक कर दीजिए, कोई बात नहीं, मुझे भेज दीजिए. पर लिंक आप भेजेंगे कैसे?
मेल आईडी पे डाल दो.
Professor Afshar Alam will be joining us online. He is the Honorable Vice Chancellor of Jamia Hamdard.
ऐसा लिंक हाँ सर, ये एक लिंक भेजा आपको सर व्हाट्सएप।
We welcome Professor Afshar Alam, Vice Chancellor, Jamia Hamdard. A big round of applause, everyone.
Thank you.
So you may start with the presidential
Okay,
remarks.
thank you very much. I'm very sorry I could not attend physically because of my one meeting with UGC secretary. So sorry for that. And I'm really happy and it's my great pleasure to welcome you all to this international conference. This is a truly unique platform for us to come together and shape the future of pharmaceutical science. This conference is organized by PRS Educational Trust in collaboration with Jamia Hamdard and Dipsiru, guided by its mandate, teaching, training, conduct research, innovation, collaboration, generating new knowledge and community service. Community service of Jamia Hamdard offer courses and programs ranging for the diploma to doctorate degree in the field of pharmacy, medical, computer science, nursing, humanities, social science, hospital and tourism management, and pure and applied sciences. Jamia Hamdard boasts being a NAC A grade accreditation in his pursuit of this mandate at this conference has been organized. I would like to bring your kind attention and structure development within the university. We have a huge banquet of courses which are being run by Jamia Hamdard to top up the pharma degree. We are going to start postgraduate degree in many more such courses. The recent proposal of amendment of Pharmacy Act in 1948 is a great step by the current government, and we are sure that the change will be revolutionary and will reform the professional landscape of pharmaceutical knowledge and education. And very certain that the occasion will able to provide a platform toward strengthening our relationship in knowledge sharing, while at the same time provide the necessary trust in a joint research collaboration and product commercialization within the research society. It is my inspiration that the conference will be the foundation for the growth of new ideas towards the better tomorrow, such as a conference cannot be organized without the wholehearted commitment and involvement of many involvement of many people, be the faculty or a student or sponsors. I admire the commitment and congratulate them to the success of this conference. And I also profusely thank the chief guest and the other honorable dignitaries for their presence and participation to encourage the enlightened the pharma and related fraternity. I wish the international conference a great success, and we look forward to building synergies and collaboration to the best educational outcome. Thank you very much.
Thank you, sir, for addressing the audience and taking time with us. Next, I request Professor... Now I request Professor Zeenat Iqbal for the vote of thanks.
Thank you so much, Manvi, and I acknowledge the great presence of our Honorable Vice Chancellor who has joined online. I think we live in that level of technology where you can bring in anybody in the house. I acknowledge the presence of His Excellency, the Ambassador of Bosnia. Thank you so much, sir, for joining on these deliberations. The vote of thanks is the toughest job, and it is toughest now because I'm standing between you and your lunch. But the food for thought which you people have got here, खाना इंशाल्लाह रोज़े खाते रहेंगे, but the food for thought which you have got here is something which will need a lot of reminiscing, a lot of remembering, and a lot of rejuvenating your own selves. So to cast a formal vote of thanks on behalf of the organizing committee, I'm extremely privileged to thank each one of you in the hall to begin with. And after these wonderful deliberations, I would maintain that thanks are the highest form of thought and that gratitude is happiness doubled by wonder. Foremost, our deeply felt profuse thanksgiving to the most venerated and respected scientist par excellence, the mover and shaker of the pharmaceutical sector, a good friend of Jamia Hamdard, and an astute leader and administrator, Dr. Rajiv Raghuvanshi Sahib. Sir, your anecdotal and the type of remembrances which you brought and your experiences which you have shared with us were tremendous. I think these two Urdu couplets are dedicated to you and the students here and the lessons which primarily you have just shared a bit back. For your grit and for the decisions which you are making and for the powerhouse which you are emulating today. This couplet from Dushyant Kumar, it says, कौन कहता है कि आसमां में सुराख नहीं होता, कौन कहता है कि आसमां में सुराख नहीं होता, एक पत्थर तो तबीयत से उछालो यारो. So it is important that you have to take that plunge and you have to throw that stone into the firmament, that you bring the world down, and that is why India is the pharmacy of the world. दूसरी चीज़, ये जो सर ने बोली ना, जो आपके अंदर बेचैनी है, उस बेचैनी को अपने प्रोफेशन में डालो. वो बेचैनी जो अभी यहाँ कुर्सियों पे दिख रही है, अचकचाहट है, वो आपकी कंफर्ट जोन है, उससे निकलना, खाने के दस्तरखान तक जाना नहीं है, अपने करियर के दस्तरखान तक जाना है कि इतना सारा बुके है, मैं उसमें से क्या पिक करूँ. तो जब सर ने बोला कि it is something which is at the topmost and we have to stay there, the India is a Vishwa Guru, and without you people, without the youth which is sitting across the table, we can never become the Vishwa Guru. So it is important to understand this. Another Urdu couplet, I'll translate if you require that. It says, नज़र नज़र में उतरना कमाल होता है, नज़र नज़र में उतरना कमाल होता है, नफस नफस में बिखरना कमाल होता है, बुलंदियों पे पहुंचना कमाल नहीं, बुलंदियों पे पहुंचना कमाल नहीं, बुलंदियों पर ठहरना कमाल होता है. So you have to stay on that pinnacle. So as Indians, as pharmacists, as pharmaceutical professionals, we have to stay on that pinnacle. And with this very humble prayer, I think we will do it together. Yes, we can. As I move forward, I would primarily acknowledge the presence of the great Pro-Vice Chancellors here, and the Director here, and the eternal Pharma Guru, Professor R.K. Khar, who is primarily actually the eternal Pharma Guru. I think in this hall, most of us have been touched, our lives have been touched by him. Thank you so much. This auspicious occasion, I would like to thank Professor Afrozul Haq Sahib, Professor Rehan Saab, now in absentia, Professor P.K. Sahu, and thank you so much all of you for being with us. We would like to acknowledge, especially and thanking our Honorable Vice Chancellor, despite his absolutely busy schedule. He came here online. He was deciding right in the morning whether I would like to be joining here. Unfortunately, he could not be here in physical form. Thank you so much for joining online and blessing us with your immense sort of support every time. He is leading from the front. We are poised to carve geography of excellence in Jamia Hamdard and contributing more than our share towards the nation building. And of course, your leadership is deeply, deeply acknowledged. We are immensely thankful to our star speakers. I have two of my favorite people sitting in the first row, Dr. Rinku Kalra and Dr. Naveen Kalra. Sir, thank you so much for being here. We have all our speakers who have been drawn from the various LEs of pharmaceutical and allied sciences who have generously agreed to grace our scientific sessions. We will have another online session with some of our dignitaries, namely Dr. Sadiq, who would join us from USA, and Professor Neeraj, who would be joining us from Malaysia. They are all an institution in themselves. I must also take this time out to convey our congratulations and acknowledge the presence of Professor Javed Ali, who has been bestowed with the award which you have recently witnessed. I have to acknowledge Dr. Sanchit Sharma and Hamdard alumnus at the helm of the affairs of Emil Pharmaceuticals. We acknowledge the great support which you have always been giving to us. Thanks a lot. This paragraph needs a proper attention because if I miss this out, I'll really repent. The event of this magnanimity need nuanced and perfect curation. Many brains, a lot of brawn. The power couple, Akhil and Shweta Sharma, conceived this thought. Professor Shahryar, whose name itself translates to city friend, is the reliable, resilient superpower and greatest of the friend whose efforts and commitment is what you are all seeing here. His magnetism attracted the stellar personality of Professor Mumtaz Alam, whose broad shoulders literally uplifted this international seminar and added the much needed value. In the same breath, we acknowledge the contribution from our conveners, co-conveners, committee chairs, committee members who joined hands from different parts of the country and generously became part of this eventful professional journey. Thanks are due to our young brigade, Dr. Muhammad Ahmed Khan, who also chaired the registration committee, Dr. Amir Mirza, Dr. Fazia Zakir from Dipsaru, and Dr. Manvi Singh from SGT University, who has been your anchor today, whose active and agile participation added life and vigor to the event. Furthermore, I would like to express our gratitude to all the deans, the HODs, our colleagues. I acknowledge the presence. I would not be able to take all the names, but Professor Maimuna is here, Professor Shaukat Rasool is here, and all my co-teachers are here. I really, really acknowledge your presence and your kind presence here. I must put on record that this is a very, very successful international conference. Alhamdulillah. All praise to be him. And we had around 410 registrations, around 125 oral and poster presentations, and we have been riding pretty nicely on the technology wave and managing a hybrid mode show which is live on YouTube and Facebook, expectably reaching out to thousands of audience. We thank the IT and the Constitution Club of India management for cooperating by all means. These deliberations heavily rely on the energy, interest, intent, love, and brilliant presence of our youth, our dear students who have traveled from Kanpur to know a bit. I think 24 of them are here from Kanpur and many more from the other parts of the country. Our dear students, you have been really a pleasure for all of us. You are absolutely welcome to Delhi, to Jamia Hamdard, in virtually perhaps, and absolutely it's a treat for all of us to have you here. And at the end, हम आप सबके बहुत बहुत बेहद मशकूर और ममनू हैं कि आपने इस इनक़ाद पज़ीर जलसे की रौनक को दोबाला किया और ज़ीनत बख्शी. शुक्रिया बहुत बहुत. Hope you have the most fruitful scientific deliberations and make good of it. Thank you so much.
I request everyone to please stand up for the national anthem.
Who's ready to hatch some cool pets? Click here to make your...
Janagana mana adhinayak jaya he Bharat bhagya vidhata Punjab Sindh Gujarat Maratha Dravid लवङ्गा विन्ध्य हिमाचल यमुना गङ्गा उच्चल जलधितरङ्गा तव शुभ नामे जागे तव शुभ आशिष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Everyone, please proceed for the high tea. Thank you so much. And please join the scientific sessions after 15 minutes.
Kindly for the students, an announcement here. For those who are presenting, I think I was getting a lot of queries while I was sitting here. After your tea, for those who have to give a presentation either orally or in the e-poster form, please proceed to the hall just adjacent to this hall. Thank you so much. Have a quick bite, have a quick tea, and then please on to this hall. शहरियार सर एक फोटो खिंचा लो सबके साथ ऊपर अखिल को ही बुला लो आ जाओ श्वेता का अखिल आ जाओ अहमद को भेज जल्दी
आ जाओ ज़ैर आमिर सबा शौकत भाई किसको सारे पार्टिसिपेंट को
Can I request the LOC people to be on the dais for a picture? Dr. Shaukat, may I request you to please be on the dais? Javed sir, Rinku ma'am, Naveen sir, please.
संचित भी है संचित
अहमद साहब नहीं आएंगे अरे आओ ना
अभी भेजती हूँ मैं आपको अच्छा ले लिया
फीडबैक्स कहाँ हैं फीडबैक्स
नेक्स्ट सेशन के स्पीकर कौन है जी सच्चाई के लिए
जी जी बाद में ले लेंगे
हाँ जी
ठीक है इधर चलते हैं ना वो हमारे साथ
आप एक बार सर को लेके जाइए शर्मा जी एक बार सर को
हेलो
So hello guys. मैंने स्पीच दी आधे घंटे
अप्रॉक्सीमेटली 1:30 1:30 3:30 तक मिल सर बस एक बार ये सर आ गया